Hi, and hello to everyone. My name is Benita Hutchinson, and I'm a licensed mental health therapist in New Jersey and North Carolina. I'm also a licensed advanced alcohol and drug counselor for those of you who live in California who are struggling with addiction of any kind, and for those of you who live in North Carolina. I'm a licensed clinical addiction specialist as well as a certified clinical supervisor in North Carolina for drug counseling, and I'm a mental health supervisor for those of you who may be here as a professional seeking some information or training on how to work with people that are dealing with anxiety, because it exists in lots of people. It exists sometimes stronger in some people than others, but it's a pretty universal thing that can happen to anyone at any time. In the educational portions of what I share, I want to put the disclaimer out that this is not any means of therapy. This is information and education that I'm providing here today. And yes, I am available and taking new clients and patients on, as well as in North Carolina, people that need clinical supervision once they go from graduate school or once they register to be a licensed therapist in North Carolina. I'm a clinical supervisor in North Carolina for both mental health and addiction. Our focus today, as I stated, is anxiety and stress, and it's a universal thing. It's been around since man first existed. It's a very natural state to be in. It's a feeling just like any other feeling, whether it's joy, happiness, um, sadness, anger, anxiety. It's on the list. There are over 50 different emotions that are on a chart that I have that I first learned about in graduate school. I'm a graduate from Xavier University in Cincinnati, Ohio. I have my master's degree in agency and community counseling. I have held that degree for a little over 25 years now, and I work in private practice, and I provide individual, group, couples, family, as well as supervision, clinical supervision to people that come to me seeking services or through a referral from a professional or self-referral. The website is bhutchinsoncounseling.com. You can go there. You can find out more about me and my background. But for today, as I stated, I want to focus on anxiety. There are some things that I've learned along the way, well after graduate school, that I thought might be useful to those of us in the field or just those of us who are seeking some ways to just not be so overwhelmed this year where the world is coming at us, or in a life or lifestyle where events, people, places, and things seem to be more stressful or creating feelings of discomfort, dis-ease, anxiousness, restlessness, or interfering with our sleep or our peace. When I think of anxiety, it can look different depending on who we are, depending on where we are in our lives. Breathing, the breath, is a natural way to manage lots of mental health things that happen, as well as lots of just emotions that we have. In a single day, one person will have over 1,000 thoughts, and we may experience just a plethora of emotions. One of those emotions could be feeling anxious. It could be feeling overwhelmed. It could be feeling indecisive or being indecisive. One thing that I've learned that can be helpful is first being able to identify. So, step one is identifying, and even as a professional, teaching people what the emotions are, because most folks stay in mad, glad, or sad. We don't venture into a lot of the other emotions that exist or when they pop up, we don't recognize them. Life today is so swift and so fast that oftentimes we cannot even begin to slow down in order to see what it is we're feeling. Something happens, we have a thought or feel a certain way, and then we kind of just move on through. Um, when that happens too often, many times it shows up in other places in our lives, such as trouble falling asleep, trouble staying asleep, um, or even not being able to sleep at all. So, yes, I do have training in sleep disorders. I have training with things like how to change, rearrange, or even initiate routines and certain things that will help to manage symptoms of anxiety. Um, People often ask me, hey, Miss Hutchinson, is worry and anxiety the same thing? Yes, it's just a vernacular, it's just your choice of wording. Um, However, having a diagnosis of anxiety is not the same as worrying. As I stated earlier, it's a universal thing. It's one of those things. We can be anxious or we can worry. Um, Being diagnosed is something different. What you may not know as a professional or as just someone here for education or information, you may not know that there are 6 different types of anxiety that exist. And anxiety on steroids, I tell people, is post traumatic stress disorder. Um, there's a huge blue book that, as a licensed therapist, psychotherapist, and supervisor, that I have studied for the past 25, 26 years, and that's called the DSM 5TR. So they have changed this book at least 3 times since I've been practicing. It was the DSM 4 when I started, then it went to 5, then it went to um, 5TR. So yeah, they keep updating and revising, but I think the greatest thing about the current edition is that it includes exceptions and it normalizes the fact that we are all not the same. They talk about culture, they talk about ethnicity and race, how something that may be the norm for an African American family um, may not be the norm for a Hispanic, Latino, or Asian family. And so they are now talking about that as a whole in this profession, which I think is a wonderful thing to include. Um, I would certainly recommend and advise any and all of you listening to this um, recorded educational, psychoeducational seminar here. I would encourage you to stop and to not try and diagnose yourself. Um, WebMD, Wikipedia, um, that can provide some general information, and the latter of the two can certainly provide some misinformation. So I would recommend, if you think you have an anxiety disorder or are even suffering from post-traumatic stress disorder, as a nationally licensed trauma therapist, I would recommend you reach out to someone, a medical doctor, a psychiatrist, or a therapist like myself. Reach out to someone so that you can be assessed. That is the first step in actually working with a therapist or psychiatrist, is to talk to a professional and be assessed for it. There are criteria, and just like with COVID, just because you have a symptom doesn't mean you have the disease. Mental health and addiction can sometimes be termed as a disease. Certainly, once you're suffering from something in the mental health world and you get assessed, it's just like medically. If they find that you have asthma, even if you don't have an asthma attack, you still have asthma. That's how mental health is. So if you are assessed and it's determined that you have, some adjustment disorders because things have changed too rapidly or you're having trouble struggling to adjust. Um, it doesn't go away, it's still there, even if the symptoms are less next year or if they're more. Same thing with things like alcoholism. Um, Once you are aware and diagnosed with something like that, it's not gone. It just can be managed, just as anxiety can be managed. So let me get back to that for you. Um, I'm recording this because I know that cost and help and trainings, as well as information, can be very useful and helpful in you deciding or moving forward or making things better in your life. So there are holistic ways to manage anxiety when it does show up. There are scales to measure it. There are assessments to look at it under a microscope. And there's therapy as well as skill development and tools that you can use to help you with those things. One of the things I've been doing is writing my book. It is not complete as of yet, but I'm working on it, and it will certainly be about stress, anxiety, and no, I'll leave trauma out of it for the most part, but stress and anxiety and how to manage and live through and get through those things. So, in saying that, something that people aren't aware of is that stress, once you carry it in your body for too long, it can start out with feelings of anxiousness, but then it's just overwhelming. It's repeated. It's interfering with things like just sitting at your desk and working. Stress can start to mimic things like a heart attack, just like anxiety can increase and become things like panic. Not everyone that has anxiety or general anxiety disorder has a panic attack. So panic is one of the, remember I told you there were 6 different types of anxiety. That can be something that occurs in someone, and it could be something that never shows up in someone that is dealing with a lot of worry and anxiousness. Our central nervous system, our physical response to words, actions, and thoughts are all connected to our brains. That's the simplest way I can put this to help you to see where I'm going today. There's something called hormones that all of us have. They are released at different times in a response to what we're going through in our lives. And a very helpful, a very effective way of reducing your anxiety, stress, worry, trouble sleeping is with movement. I recommend here, as I've been told by physicians and psychiatrists, that changing your lifestyle can help to reduce and or manage depression, anxiety, and stress. Yeah. A lot of people don't connect those things, but studies have shown people who work out more, people who do yoga, people who walk consistently and regularly can oftentimes be at a state of health and wellness that allows them to be resilient when things come like the things that are happening currently this year, last year, and the year before on this planet. Where we carry our stress, where we carry our anxiety and worry, each person is different. So sometimes it's in a different place. A lot of people, however, carry their stress and their anxiety on their shoulders, believe it or not. It's like you've heard it described as the weight of the world, or feeling lighter after something changes or a situation is resolved. It's very true. It can be very heavy, It can also cause headaches, um, heart palpitations, can mimic a heart attack even. They have these stress tests they do if you rush into the hospital and you say, my chest is hurting. You know, they're going to usher you back, put you in a gown, they're going to draw some blood, they're going to take your blood pressure, blah, 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 blah. But you, just as I cannot determine if my chest hurting and feeling like I'm going to die, if it's actually a heart attack or if it's just stress overload, that is certainly a reason to either get yourself to a hospital, a emergency room, and have it checked. If you are weighing it out and seeing if it goes away, um, you may want to call your doctor to get their advice because, like I said, we can't determine that. We can't determine that in my office, and you can't see it because you can't see your heart as if you had an ultrasound to see if there's some kind of problems with your heart. You can't see that with your human eye. You need a ultrasound, and you also can't determine because you don't know what's going on with your chest and your heart if you don't do the test like an emergency room would or your physician's office to see what enzymes have been released in your bloodstream that would either allow them to know that yes, you are having cardiac symptoms and cardiac arrest or whatever it may be, and then they help and treat you for that, or if it's just what we call in therapy a symptom, a reaction to your environment or your thoughts, and they call it, I'm looking for the correct big word here. Let me see. Okay. So it is, I'm a visual learner, so I see the word SON because it's not an automatic response. It's a, let me see what word that is. It's a somatic. That is the word. It's a somatic symptom. Our nervous system, it has a automatic part to it and it has a somatic part to it. And oftentimes when we have symptoms of something, that doesn't mean we have the full criteria of the diagnosis or the disease that may be present in our bodies or within us. So the vagus nerve, I want to go there. The vagus nerve it's found on the 10th cranial nerve within us. It is connected to things like control of your heart and lungs. And that's why as a mental health professional, when people think they're having a heart attack or actually go through a panic attack or even have stress that is overwhelming, debilitating, or just manifesting itself as physical symptoms in their body, such as the headaches, stomach pains, chest palpitations. That's why many physicians refer people to a mental health professional such as myself, because they've done the test or they've looked at your symptoms and they've determined there's nothing wrong with your lungs, or and I say lungs because with panic attacks sometimes it's hard to breathe. Sometimes people feel like they're choking, so they check those things out if you go to your MD or an emergency room. But with cardio issues and problems, you may be referred to a specialist if you show up in the ER and they do what they do, but they don't find anything right away. And you may want to go to a specialist just to be tested and make sure, because men and women don't present with the same symptoms when they are actually having a heart attack. And a specialist is someone that every day they focuses specifically on whether it's your heart or your respiratory system. So that's why I said that. The parasympathetic part of our nervous system can take a thought, a feeling, or something we see, and then it's internalized, and then our body has a response to it. Think about when you watch a scary movie and you may jump. You didn't say, "Ooh, let me jump out of the way." No, you were like, "Woo," because it frightened you, it startled you. That is an automatic response to what's happening. When we do things like blink and breathe, those are things that we're not consciously telling ourselves to do, but that is certainly a part of the automatic systems within us that work in our bodies. So when we get to the nervous system and the sensory receptors in our body, the things that help us to feel things, that is a part of our nervous system. The signals travel up and down our bodies. And before I get into the science and the scientific and the biological pieces of all this, I want to stop and slow down and just give you, in these next 5 to 7 minutes, some helpful things that can reduce or allow us to manage things like anxiety and worry. One of those things is square breathing. We breathe all the time. However, in moments of stress, anxiety, and worry, we tense up. We often hold our breath. Or when we're afraid even, and worried, or in a panic, or traumatized, we're not doing the deep belly breathing. So learning how to stop, slow down, and take a deep breath can be very helpful and useful when you're dealing with anxiety or trauma. Some other things, anxiousness and anxiety, you can interchange those words as far as I'm concerned. Some people are very specific. No, it's not the same, Mrs. H. Well, potato is still something we eat if you choose to. It's still starch, and it's still nourishment for our bodies. So anxiety is certainly a clinical term, something that we can then look at and then begin to put a microscope to, to see it better and to understand and scale and rate how intense or frequent you have a certain symptom, to measure a criteria against for a diagnosis, or even to just better know and understand what someone is going through. That brings clarity, whereas anxious, I look at that as more kind of like a verb. She was anxious, he is anxious, I am very anxious right now, versus it being a clinical term like anxiety. So yes, that is one of those 50 things on the chart. A person can be anxious. It's a natural state of being to be anxious. Helpful things that we can do with the breathing is certainly talk to someone we trust, or you can talk to a professional. There are thousands of professionals that can be found on Psychology Today. You can do things. Like I said, I would recommend, you get a therapist if you feel like you need one and they can help you through this thing. You can see your medical doctor. They can often help. And if you're someone like myself, you can pay attention. And a lot of people don't make this connection, but the things we eat certainly impact our energy levels. It impacts our physical state. It impacts how we react and respond also. Imagine someone that has not eaten all day, and I'll put myself out there. You haven't eaten all day, you've been working since 7 a.m., and now it's like 2 o'clock in the afternoon. You may begin to have lower energy. You may begin to be irritable. See, having those things could be symptoms of depression, but no, it could just be because I didn't eat anything this morning. So what we eat, staying hydrated is important, but the thoughts that we have, they impact our emotions also. If we get enough rest or we don't, that impacts how we feel. So there are a lot of things that go into someone being diagnosed with a mental health condition, other than just the symptoms. It's a lot of things that go into that. So I recommend you taking this as education and information. I would never tell anyone what to do, but I can share my knowledge and my wisdom in this area as well as my training with you. And again, I thank you for listening to this. And if you like it, please like and subscribe so that you can stay tuned and listen to more of the information, the education, and the therapeutic and clinical ways that things can be supported for your mental health or your recovery, or to just identify addiction issues in your life or family members. Thanks, and have a beautiful day.